Liz Edgell, and today we're going to talk about using health insurance to actually access care. So the goal is that I'm going to give you some plain language and resources to use if you're working with clients who may not understand how their insurance works. And also recognizing that we don't all speak health insurance every day, so we can use these guidance and terminology to help ourselves or our family also. So the goal, again, is to assist folks in actually using their health insurance. So we'll talk about when to use your insurance card, like when to pull it out and look at it, when to show it to others. Cover a few terms and cost factors. We'll talk about how to keep your coverage once you've got it. We'll explain a little bit about the levels of care within Kentucky's healthcare system, using the right place at the right time, and then understanding what services and providers are covered by your insurance plan. So I frequently refer to this booklet. It's called From Coverage to Care, or C2C. It was created by the Centers for Medicare and Medicaid Services when the Affordable Care Act went into place. The idea is that it's a pretty thorough booklet on how to access our healthcare system, more than just getting your insurance card, but how to use it, how to seek primary care, how to think about prevention, and get over some of the bad habits that folks may have had when they didn't have health insurance, like delaying care or not getting screenings. So it's a really good resource booklet. You can get it. The website's there. You can order print copies. I think you can get about 100 of them for free at once. You can also just use and print off certain pages from the website or use their other resources. So I always like to just start up front with that booklet. Some of the images and examples that I use in my presentations come from it directly. So again, we'll start with sort of the terms and the cost. And we'll try to use simple terms throughout this presentation that you may want to use with others. But by understanding some of the definitions, it will help you use your care better. And the first thing we'll talk about is when to use your insurance card. So when you are making an appointment for medical, dental, vision, or mental health services, you want to pull out your insurance card because you want to be able to tell the people when you call what insurance you have and make sure they are in network. You want to make sure they work together with your insurance company. When you're signing in, when you show up at an appointment and you're letting them know that you have arrived, it's very important to show them your insurance card and make sure they have a copy, because otherwise they may bill you. You want to make sure that you don't get billed for the services that your insurance might have paid for. And also, sometimes we get new cards in the mail. We don't realize that the numbers have changed or something's different on it, but it's important to go on and show your providers, your healthcare providers, your most up-to-date card. When you're in the exam room, we don't think about this all of the time, but when your providers suggest a procedure or a medication, it's important to go on and have that discussion about what your insurance coverage is. For example, if you have a high deductible and you're going to have to pay a large amount of money before your insurance company will kick in and help you, you want to let your provider know that. Is this something that's important enough that I do it now? Is this something that could be done in a more cost-effective way? Is this a necessary test or just sort of a nice thing to do? And you need to just, some of us get shy about finances or don't think about talking with our provider about it, but they're important conversations to have. That also, when your provider knows which insurance you have, it sometimes helps them decide which medication to prescribe or which treatment to offer, because they all do cover different things. Similarly, at the pharmacy, if you are getting a prescription medication, it is very important to show them your insurance to see what the insurance will pay for. There's sort of an important triangle that happens between the pharmacy, your health insurance company, and your medical provider. Sometimes certain medicines aren't covered, but the pharmacist or your provider can advocate for you and get it covered by filling out certain forms. Or sometimes they can look at the formulary from your insurance and change the medication to something that's very similar that would be covered. So those are important conversations to have. Also, if you are in an emergent situation, if you've ended up in an ambulance or some sort of emergency, it may not be top of mind, but it's important to have your insurance card with you in case of emergencies and to show it to them, because those ambulances are usually their own services and they bill separately, and you want them to have your insurance information. And then when you have a question, when you're not sure what would be covered or what provider to go see, there is a member services number on your insurance card. Most of the time it's on the back. Sometimes it may be on the front of the card, but you have that coverage, and it very often the insurance company wants to make sure you use the healthcare system in a logical way, in a cost-effective way, so they can be your assistant. They can help you decide where to go or what's covered and what's not. So don't hesitate to call and ask. And usually a good idea to call and ask before you seek a service or before you actually get the bill. So we're talking about when to use your insurance card. This slide is about what you can find, the information you can find. This is from that Coverage to Care booklet, this image. So they've, I think for the sake of saving space, they kind of piled everything on the front of a card. In real life, you would have a big company logo, and some of this information would be on the back of the card. But these are key things you need to be able to identify. So if you're working with a client, at this point, you might have them pull out their insurance card and really ask them, like, can you find your name, your group number? Can you find your plan number? Sometimes if you're making a phone call to your insurance company, you have to type in those numbers, or if you're making an appointment, they may ask you for your insurance information, and you need to be able to locate it. Sometimes, like in that box that says number 7, it's a helpful and easy way to find out what your copays might be. For example, that one has your prescription copay information. In box number 5 on this image, it talks about what the copay would be for the PCP, for your primary care provider, $15. For a specialist, it goes up to $25. And for an emergency room copay, it's $75. So sometimes at a quick glance, you can get information about the levels of care and the costs of care, and that can help you make a decision about where to go. So there's lots of information available to you right there on your insurance card. There's a document that sometimes you'll receive, especially with commercial insurance or private insurance. It's called the Explanation of Benefits, or EOB. And to be honest, I received many of these for many years and had not a clue what to do with them. It's just a paper that you got. It is really important to know this is not the bill. And it says right on there, somewhere on the EOB, it will say this is not a bill. They are required to say that. So it's just a summary document. It lets you know what services you received. It would have the date of service and what was billed for, what was charged to your insurance. It shows the cost that your provider charged. It shows what your health insurance paid. Sometimes this is where you can really see the cost of healthcare and see that when you're in network, they negotiate certain rates and they're really quite different than what the provider might have asked for. And it will tell you what you will owe. You will not owe it with this. This is not a bill, but it would show you what you might get a bill for in the future. Right now, Medicaid and K-CHIP do not have EOBs, but it's possible that they might send them at some date. So it's a good document to be familiar with. I've actually used this in my personal life to dispute a claim, because it was an example at a pediatrician's office where one of my children had an appointment. I had called and asked if the other one could get a flu shot. So we just wanted to save a trip. We wanted both of the kids to be there. So one needed an appointment, the other did not. But something apparently went wrong on the scheduling side, and they scheduled the child who just needed a flu shot. They made it look like she had an appointment with the doctor. And later we got a bill for a no-show. They said that we didn't show up, we didn't she missed her appointment, and I knew that wasn't true. My EOB showed that she had been given the flu shot. So I was able to say, how could she have a service and not show up? And so then they realized it was a scheduling error, and then they took away the fee they had charged us. So occasionally it can save you money if you pay attention to your EOB or you save it. It's just one example. So we've talked a little bit about copays, and the EOB talks about payments. So a big part of our health insurance system, unfortunately, is cost sharing and money. And this example of the green picture on the side of the slide is actually from that Coverage to Care booklet. It's an example of what it might cost if you have a normal delivery, if you've had a baby. And it breaks down what some of the hospital charges might be, the anesthesia charge, the vaccines or preventive care. The total in this example is $7,540. So you can see that it's pretty expensive to have a baby. But in this case, what does the patient really have to pay? Well, they have to pay their deductible. That's the amount that you pay before your insurance kicks in. So in this case, it looks like the deductible was $700. The patient usually has to pay the copay. So in this case, there was a $30 copay for the delivery of the baby at the hospital. And in this case, they have co-insurance. So that means after the deductible, they pay a percentage of the cost while the insurance pays the remainder. So in this case, the patient paid a total of $2,050. But the health insurance plan picked up the rest. So the plan paid $5,490. So this is a snapshot. Of course, these are made up numbers. This may not be the cost of your delivery at all, but it helps you get a sense of what a copay would be, what a deductible would be, what coinsurance might be. And you may say, well, gosh, $2,050 for the birth of this baby is a lot of money. But when you see that the total was $7,540, you realize how helpful it is to have health insurance. So when we have insurance, many people have struggled finding insurance that they can afford, or getting enrolled in Medicaid, or getting enrolled in health insurance. But that's really only half the battle. We're going to talk about how to keep your coverage once you've got it. So your premium is the amount of money that you pay to keep your health insurance. Usually this is done monthly. We've talked about a metaphor of being a member of a club. You pay your premium every month to get your membership card and keep it, so to speak. So if you want to have your insurance pay for you when you need it, you must pay for it every month. You pay that premium every month. So it's sort of like car insurance. Like we pay for our car insurance every month or every 6 months, however you've arranged it. And you hope you never need it. You hope that you don't have a car accident and they don't have to help you out, but you need to have it just in case. You pay to get that coverage. So it's similar with health insurance. So your premium will be due, and I can't emphasize enough how important it is to pay your premium on time and to pay it every month. There should be a variety of options of how you can pay. You should be able to pay online if you want to. You can get automatic withdrawal. You might pay by check, by mail. You may be able to pay by phone, or there may be locations where you can pay in person. There should be some options for you. You need to find out what's available to you. And this website, Manage Your Healthcare Cost, is an online resource that can help you figure out find more information about payment requirements and what you'll need to pay and how you can ask to pay. Medicaid in Kentucky has talked about adding some requirements in order to keep your coverage, and there are some that have always been in place. So make sure you know what your requirements are if you have Medicaid or any other type of health insurance. For Medicaid, since it's government insurance and since it is based on income in Kentucky, income and family size, you do have to report changes. So if you get a job and your income changes substantially, you need to report that. If you get a job, in fact, you need to report it within 30 days usually. And again, if you lose your job, you may be eligible for Medicaid again, so you would want to report those kinds of changes in income also. If your family size is changing, if you've got a pregnancy or a marriage or a divorce or something that changes that family size or household size, you want to report that also. It's important to report when you move, when you change your address. And this is practical also. So if your insurance company can't find you, you might lose your coverage. So it's important to update your address with them. There has been talk in Kentucky over the past couple of years about having rewards programs or community engagement or work requirements. None of that is in place right now. There are rewards programs you can participate in, but just keep an eye on what sort of requirements may be asked of you and make sure you're aware of them. If you are getting your health insurance from your job, there may be certain open enrollment periods where you may need to sign up for coverage or renew coverage. If you want to change coverage, there's usually a certain window and a time frame that you are allowed to do that. So make sure you're aware and you ask when that period would be. Another thing that's really important is just to sort of think about the basics of our healthcare system. It's got levels of care, and if we use the right place at the right time, then it helps us all use the system correctly. So you can usually I sum it up by saying you can save money and you can save time if you access your care in the right place. So I'm going to take a few minutes and talk about the levels of care in our healthcare system in Kentucky. I want to note that this exercise, these next few pictures and screenshots are of images that we used with the Health Education Project about levels of healthcare in the United States. And we created this with 5 different states working together with newly arrived refugees. So it was a way to explain our U.S. healthcare system. But I have found that it works for all audiences. You could make an activity if you're doing a health education class. You could have these big pictures like this picture that's on the screen right now up on a wall and kind of explain the levels of care. And then the next slide will show different small images that you would cut off and hand to people and say, where would you go? Which level of care would you use? I've also done it at health fairs before where you just have it out on a table. You have the 4 different levels of care and you hand somebody a scenario and you ask them where they would go and you talk about it. And I've done it with kids and adults alike. So it's here as an example if you wanted to get hands-on and do an activity, or also just to have your talking points ready. So I like to start with primary care and prevention because that's the easiest and cheapest thing to do is to try to keep ourselves healthy. And that would be things like having a primary care provider, getting those screenings that you're eligible for your children, doing the well child checks to make sure they're growing adequately and everything's going okay. This would include things like vaccinations to prevent sickness. It's also your basic healthy living strategies like eating healthy food and exercising, drinking water in the summer, avoiding fast food and soft drinks and those kinds of things. So all of your basic strategies. And the next slide shows images that you could use if you wanted to do an activity where you would hand somebody a picture and say, find the example, what level of care would this be? So this could be things like vaccinations and washing your hands or going to your PCP's office or exercising. So those images are there if you want to use them. The next level, I usually frame it as, we all do get sick sometimes. But there are many things that we can take care of at home. In fact, our human body is pretty phenomenal. So sometimes we just need sleep and we need liquids and our body can handle the rest on its own. And we also have the convenience of our local pharmacies and over-the-counter medicine. So those are the things you do not need to see a provider. You don't have to see a doctor or get a prescription. In fact, I think in our healthcare system, there's an assumption that you're going to try some of these on your own before you call the doctor. They'll usually ask you, what have you tried and what has helped? So for headaches or coughs or colds or body pains and aches or stomach problems, all of those things you can get at your local pharmacy. And your insurance does not typically pay for over-the-counter medications. Some of them do. It's worth asking, especially if it's something that you take regularly. But for your small sicknesses, the cost is not that high, and you don't need it all of the time, so they usually expect you to pay that cost out of pocket. I like to tell people it's a good idea to find your local pharmacy that's open 24 hours, just in case you need something in the middle of the night. And pay attention to the fact that you can save money. Sometimes an over-the-counter medication is on sale, and if you know it's something that you or your family might use, you can go on and buy it when it's on sale and have it in case you need it. Another cost-saving strategy is to buy the generic medication. So usually that expensive brand name is there on the shelf. Right next to it is a very similar package with the name of the store. And you can double check the dosage on the back, but usually the active ingredient is the same. It is the same medication, and you can just save money by buying the generic one instead. I also think it's really important to remember that our pharmacists, they are there as a resource. They are there as a member of our healthcare team. So even for over-the-counter medicines, if you're not sure which one to buy, you can go and ask the pharmacist. Tell them your symptoms, and they will help you out. And so for the levels of care activity, if you were going to give images and talk about what scenarios fall under this would be your small sickness. Runny nose, stuffy nose, fever. Fever in a young baby is sort of emergent, but for the rest of us, it's a very normal thing. We can usually rest and wait at home, take medication if we really need it. The diarrhea example is pretty funny, the drawing there, but that's usually your body's normal way of getting rid of something that it needs to get rid of. The interesting thing about this activity, if you really have people talk about what level of care a certain scenario will fall under, is that some of them start with home care, and if it lasts too long or it gets more serious, then it would move to the next level. So it can be a fluid discussion. None of these has a strictly right or wrong answer. For example, the child with a cut on her arm, a lot of that would depend on how much bleeding there is and how bad the cut is. So the next level would be your primary care provider. I describe the primary care provider, or the PCP we call it, as the person you go to for most of your health problems and most of your health needs. So that's your first entry into the formal healthcare system if you need it. So if you're not feeling well and you maybe tried resting at home for a few days, you tried over-the-counter medication, but you still feel bad or it's getting worse, that's when you would call your PCP. I recommend calling early in the morning when they first open, and that way you have a better chance of getting an appointment that same day, although many places have extended hours nowadays. Some places will have a nurse you can talk to and get advice when you call them. And depending where you are in the state, there may also be immediate care centers or urgent care centers. I know in Louisville we have lots of these. It's just a question of which one your insurance company wants to work with. You have to be careful. In some places it looks like an urgent care center, but it may be connected to an emergency room, and they may charge prices more like an emergency room. But I haven't heard that happen too much in Kentucky. It's just a good question to ask. And I usually describe an immediate care center or an urgent care center as similar to a doctor's office. This is that level of care for small sickness, maybe a cough that's gone on 2 weeks and you don't know why you're still coughing. Maybe you know you have diabetes or high blood pressure and you're not feeling well. So not urgent emergency type things, but This is sickness that's beyond what you could handle at home with an over-the-counter medicine. The nice thing about immediate care centers usually is that they're open later, and they may be open on Saturday or Sunday when your primary care provider is closed. A good rule of thumb is to call your PCP first and see if they can give you advice, see if they can work you in, and if they cannot, then you can try the immediate care or urgent care option. Also, really good idea to pull out your insurance card and ask them. If you ask them which immediate care center you can go to, which one's in their network, that will usually save you money. And so these are examples of images that might fall under that idea of urgent care. You have a sore throat, you might need antibiotics, and you can't get those over the counter, so you need to see a provider. A child with a fever that's high may need an urgent care. Maybe you have pink eye that needs medication, or an earache. That kind of antibiotic is a typical need for this level of care. And the highest level in our healthcare system is the emergency room, the big hospitals, or the ambulance. So it's really important to realize that emergency rooms and hospitals are for the big needs, the very serious things. Maybe a woman who's about to have a baby or a car accident. As far as the ambulance goes, I like to recommend that folks ask 2 questions before they call 911. Ask yourself if you need help to come right here. Do I need help to come to me right here where I am now? That's one question. The second question is, do I need help to come right now? Or can my help wait? So if you answer yes, if you say, I need help right here, I need help right now, go on and call 911. They can save your life. If the answer is, well, I think it can wait a little bit, or my husband can drive me to the hospital, or maybe a taxi or an Uber can get me there safely, that might be a better option. The cost of ambulance is very, very expensive. With your private insurance, if you have commercial insurance, they may not want to pay for an ambulance. They may say you didn't really need it. And you can dispute that, you can argue with them, but it's a big hassle. So if you think about it on the front end, do I really need this help right now? Do I need it right here? They can help guide if you really need the ambulance or not. And of course, safety. And I don't want to speak so much about cost and finances that you would make a health decision solely based on that. If you really need help, you go on and you get it now. And there's always a way to deal with the finances later. But I think also we can be responsible and use the system the best way. The other problem is if you go to the emergency room and you don't really have an emergency, you may wait. You may wait for a very long time. They're going to see the sickest people first. And you may be exposed to other things while you're waiting there, so it may not always be the best option. And these are the images that might go along with the activity if you were going to have people decide when to go to the emergency room. So dizziness, somebody who's needed CPR, someone who's got a broken bone, a woman in labor, falling down the steps, having a bad fall. So these would be appropriate times to go and seek emergency care. So again, that activity, you could use those images, cut them up, make them small, card size, hand them out to an audience, and have some good discussion. The From Coverage to Care booklet also has this example. They just sort of contrast primary care provider to the emergency department. And I think prior to the Affordable Care Act, a lot of folks who did not have insurance did not have an established primary care provider. So we're still kind of teaching people that, to have somebody, a medical home that they go to, somebody who knows them. In the past, if you didn't have primary care, if you didn't have health insurance, you would usually wait until it was a very bad, very serious problem and then go to the emergency room. But we want to sort of rethink that system. We want to think about it in different levels of care so that we can save money and save time. In this slide, they've highlighted the fact that your copay is smaller at the primary care provider office than the emergency department, that you can make an appointment, you can plan ahead, that it will be quicker in and out to the door usually, and that they would have access to your healthcare records. So they know your health history, they know what you look like on a normal day, and that helps them make better decisions about your care. At the emergency room, you're likely to see someone who's never seen you before. They may not have access to your whole health record and know your past. And at the bottom of the slide is where they mention urgent care. So it says it may be available in your area, but call your health plan and find out how much you will have to pay. So another thing we want to talk about is finding out what services are covered under your insurance and what providers would be covered and paid for. So this document is called the Summary of Benefits and Coverage. And these are just examples. So the picture on the left, the Anthem one, may be what your benefits look like, your Summary of Benefits document that you usually get in the mail. They're also available online. There also is a tool that you can use. You can use this when you're choosing which insurance plan you want to buy, kind of seeing which services would be covered. There's a lot of information on this, and I don't think it's important to know every detail of what's covered, but I think it's really important that everyone knows how to get that information when they need it, and know that you have the right to ask for it. So you can call your insurance plan at any time and ask for this booklet, or where to find it online. And if there's any change or an open enrollment period, a time when you can change your coverage, they're obligated to share this information with you. We also want to go on and make sure that people know there are other types of healthcare providers, and taking care of your eyes, taking care of your teeth. These are important components of your health and staying healthy. So you want to ask your insurance company, what do they pay toward that? Do they cover any basic dental? Do they cover an eye exam? And every plan will be different, and so it's important to go on and know. Social workers or doctors in your area may know where to get the cheapest dental coverage, where to get the cheapest glasses. Usually they have resources that they can share with you. Note that your child's coverage may be different than yours. So right now, many Kentuckians have dental coverage and some vision coverage under Medicaid, but the rules can be a little bit different between children and adults. So always ask and find out what you're eligible for. And just a note that mental health care is vital too, and that it is covered. So there are times when we all feel sad, angry, worried, scared, or confused. These are all entirely normal feelings. Usually they go away on their own. We can have a certain amount of stress and it will go away with some time, or if we're adjusting to a move or a job change or something, we'll feel better after some time has gone by. But if you notice a change in your sleeping habits, if you're having trouble falling asleep or staying asleep, if you're having nightmares, if your eating habits are changing, for some people that might be eating a lot more than normal. For others, it might be not eating and losing weight. Or if you have that feeling of it's very difficult just to get out of bed and do the things I need to do, those are all signs that it might be a bigger health problem. And we just want to spread the word that there are people who can help us. There are healthcare providers to prescribe medicines to help you sleep better or feel better. Sometimes you might not need medicine or want to take medicine. There might be someone you can talk to and feel better by doing that. So just to note that mental health care services are covered by insurance. It's an essential health benefit. Medicaid will pay for these services also. So be sure to think of that in the same way you would think about getting your blood pressure checked. That you have the right to talk to somebody about this. Call your insurance company and see what providers are available and what services are covered. And a reminder that finding in-network providers is really vital. The in-network providers are the ones that your health insurance has made special arrangements with, And if you go and see them, if you stay in network, it usually saves you money. And this is not just about the doctors. It can be about the radiologists who look at your x-rays. It could be about the hospital facility or the place where you get outpatient labs. So be sure to call your insurance company, that number on the back of your insurance card, and find out who's in network. If you have access to the internet, you can usually find this information through your health plan's website. You can ask for a list of their in-network providers or where to find them online. Another strategy is to call the provider when you're making an appointment. If it's a new doctor you haven't seen before, be sure to tell them what insurance you have and see if they accept it. That's their way of saying that they work with that insurance. Same thing for urgent care centers. You want to find out which ones are in network. And it's really important to be aware that that's not permanent. Those can change. Those networks can change. So you want to make sure that you ask pretty frequently who's in network. And this is a final reminder about using your health insurance to help you access care. You want to know what your plan covers and your associated costs. So those are your co-pays or the deductible that you have to meet, or your co-insurance. You want to know that up front. You've got to find out if you have a premium to pay and how you may pay it. I can't emphasize enough how important it is to pay that on time so that you sort of stay in the club, you get your coverage, you keep your coverage. Keep your insurance cards with you in case there's an emergency. Don't forget to pull it out and use it. Use it in your discussions with your provider. Show it to folks when you're getting care. And then choose the correct level of care. So we don't need to be going to the emergency room for small sickness. But we don't have to avoid our doctors. If we don't feel well, we can go to our primary care provider and catch the problem when it's small. And that saves us time and money. And there's a list of resources, including the file, the Refugee Health Coordinators. We are the group that piloted that levels of care activity. There's a whole lesson plan in there that would give you all of the wording to use and a summary of how it went when we piloted it. So all kinds of resources and information there. And my contact information is available. I really do not mind at all if you call or email me. Ask your questions. I'm glad to help. Nobody likes to talk about health insurance. So it's important that we share resources and help guide each other so that we can help guide our fellow Kentuckians and our community members.